This is Gary Atensi with CNTV, and today we're in Louisville, Colorado. We are here at East West Integrated Medicine. Since 1999, they have been blending ancient wisdom of Eastern medicine of today's modern medical knowledge. I'm here with Dr. Nita. Thanks so much for joining us here today. Why don't we begin, first of all, a little bit about yourself. In 1999, you've been in private practice here with Colorado, but it was back in, since 89, you were getting trained up, learning to be basically a holistic doctor. You're now board certified. You have studied that of yoga, as well as Western nutrition, and also complementary medicine. Share with me again a little bit about how you got started in this line of work.
Well, I started out as a regular Western-trained family practitioner, and I worked as a family practitioner for quite a few years, realized that a lot of the people that I was trying to help, I didn't have a lot of good therapies to offer them for very common things, things that are sort of a nuisance, constipation, headaches, irritable bowel, all these simple little things. I really didn't have anything good to offer people other than medication to relieve the symptoms, but not really get to the cause of the disease. So that kind of got me into the journey of looking into what else is out there.
Ayurveda, did I pronounce that correctly? Is that where you were led to initially?
I got involved in Ayurveda because, first of all, I am of Indian background, and it is an Indian form of medicine. But also, when I was at UCLA doing my residency, one of my mentors practiced Ayurveda, and I would, go and tell him, this is what's happening with somebody, and he would give me the simplest remedies to do. And I would go back and tell the patient, do this, this, and that, and they would come back 4 weeks later, and they would be so much better. And I realized that what he was offering, the Ayurvedic medicine piece, had profound influences on these patients. So I got exposed to it pretty early on, and that's why when I was looking for something, it sort of triggered me to go, well, what was that guy doing? I should look into that a little more.
Interesting. And we can trace that system, if you will, over 5,000 years. It's tradition of Hindu. Is this something that is taught regularly here in the States?
It is. There's actually quite a few programs in Ayurveda now in the U.S. There's one in Albuquerque, New Mexico. That's where I went. And it's a 2-year program in Ayurveda.
This system, this life knowledge, basically share with me some of the symptoms that you're able to alleviate with or help.
Well, it's basically a different way of looking at the body. It's a philosophy. Ayurveda is really a philosophy. It's a way of life. It's the science of self-healing. So it's a different way of looking at the body. It's really a different way of understanding what's happening to your body. And as a result, there's really so many remedies. We do a lot with diet. We do a lot with lifestyle. We do a lot with herbs. But so much of it is just how you live, stress. We're looking at the mind. We're looking at the body, and we're looking at you from an energetic point of view as well. So it's a very holistic science.
Energy-wise, I like you said that because a lot of folks speak of doing energy work. How does that differ in the components of what you're doing of that of dosha?
Basically, we believe in quantum physics, that energy and matter is related. So when we talk about energy from an Ayurvedic point of view, what we're saying is that the physical body there's a spectrum between physical and energetic. And so, you can condense down to the very physical level, or you can sort of slowly go up to this energetic level, pretty much in the same way that quantum physics talks about it. So it's a different way of thinking about things. And a lot of our herbs or a lot of our diets have an energetic component. They have an energetic effect on the body. So it's the same food that you're eating, but we say that every food, every lifestyle, every herb thing that you do has an energetic effect on the body and can have as a result, a physical effect on the body.
Obviously, the success that you've experienced here is because you take a very customized approach of treatments for each individual. How is the diagnosis different compared to what others may have gone through here?
I can do the whole Western diagnosis thing, but most people already come in with that. So when they come in to see me, I tend to skip that part because they've had it done multiple times, and I do a more Eastern diagnosis. So one of the things we do is we look at people's faces and we do face reading. I look at their tongues, and we have a way of diagnosing through the tongue. I look at their nails. There's a lot we can tell from people's nails. And then I do what's called a pulse diagnosis, which is a very traditional way of diagnosing which is really feeling somebody's pulses at the wrist, and from that getting a lot of information.
Share with us at a consultation, is this something done one-on-one with you and them, or are there other folks here that are professionals able to do that?
Well, the consultations are with me. They're private, and you prepare for it. They do a history and really get me a lot of information that I need so I can be prepared. And then we go through their history. We do the physical. After we come up with a plan, they do meet with my nutritionist. And that's about a 30-minute visit after they've seen me, because most people leave a bit overwhelmed. And I really feel that it helps them to have that follow-up with my nutritionist to reinforce some of the things we've talked about. They usually have a bunch of questions, and it's just a nice follow-up after they leave to be able to know that they're going to follow up with her and get a little more information.
Wonderful. I mean, traditionally, or even more common, many times people don't feel well. They may get some tests done, even some blood work done, only to find out that their blood work comes back somewhat normal. Share with me a little bit how your analysis is able to still help folks like that.
Well, I tend to look at blood work from a more functional point of view. So this is also a Western concept. There's a lot of functional medicine doctors out there. And so functional medicine is really saying that for optimal health, the range of blood work should be much narrower. So blood work is sort of, you could be from 0.5 to 5, and that's considered normal. While when we look at it functionally, we know that for optimum health, maybe that range needs to be more like from 1 to 3 is normal. So it's getting the ends of that bell-shaped curve and bringing it down and really looking at things a little more critically. Also, we know that there are certain relationships between different blood work numbers, and we look at those relationships and we can tell if something seems to be going in the wrong direction.
Obviously, in the media right now, health is very important for most folks out there, be it on Dr. Oz or any media outlet. You hear a big buzz about PEMF. Share with me a little bit about what that is.
Pulsed magnetic frequency therapy is really innovative new therapy. Basically, what it does is it's an electrical current that's going around in a tube in a circle. And what it does is it creates a magnetic field. And that magnetic field is just like the Earth's magnetic field. So what it does is it basically, by reproducing this magnetic frequency, if your cells are healthy, the magnetic field will just go through the cells. There's really no issue there. You won't feel anything. But when you have damaged, unhealthy tissue, the magnetic field of those tissues will drop. And so then this magnetic field kind of hits up against it, and you'll feel this ticking sensation. And what it's doing is it's raising slowly the magnetic field of those cells, which increases the circulation in the cells, decreases inflammation, brings oxygen to those cells, and unleashes a whole cascade of anti-inflammatory activities that helps those cells heal again.
One of the things that this is well known for is professional athletics, people that are injured or whatnot. Is that across the board something you're able to help with as well?
Absolutely. It works great. In fact, one of the things that it's most famous for is sports injuries, because it allows people who are very athletic, who are very committed to that kind of thing, to really be able to get back out and play again. It basically increases healing. So you speed up your healing process and make sure that you get up to 100% healing and not end up with scar tissue or issues like that. It's also FDA approved for a fracture or healing, so it heals bones. Yeah.
When you're actually getting it done, how does a person feel? Can you feel that going on?
Usually you'll feel that ticking sensation in the areas of injury. So we can even tell people where they have problems by testing them with the PEMF device, and usually we'll come up with the exact area of injury, and they're shocked that we know. The reason we know is you'll have a ticking sensation in that area. It will go to the area of injury and start working on that. So while you're having the therapy, you feel a little ticking sensation in that area. It's not meant to be painful. It's slightly a sense of discomfort. And then afterwards, most people will notice that the ligaments, the joints, the muscles in that area are just so much looser, almost immediate pain relief. This isn't just reducing pain, it's actually healing the area.
You also work with that of the brain in what is called clear mind. Share with us a little bit about that.
So the clear mind is a form of neurofeedback. It's called neurointegration because clear mind specifically has two components. It's neurofeedback, traditional neurofeedback, which is like biofeedback, as well as something called entrainment therapy, which just speeds up the neurofeedback. So neurofeedback is really good to train the brain, to get it to be more flexible, to get it to start thinking in different ways and moving in different ways. It's very good for anxiety, depression, ADD, ADHD. We use it for people who have memory issues, people who have cognitive issues, learning disabilities. It's been very well researched for anxiety, 90% results with cure with anxiety, which is really unheard of in the drug therapy world to be able to say that. So a neuro feedback is very well researched, and clear mind is a form of neurofeedback.
This all begins with the brain map. Share with our viewers what the brain map is and how long does that process take?
Well, the brain map is really easy to do. It's not painful at all. It takes about 30 to 45 minutes. And basically what we're doing is an EEG of the brain, and we're using some of the same technology that researchers are using. So you're getting a very fine scientific EEG of the brain, which tells us exactly what's happening in all parts of the brain, what parts of the brain seem to be not working well, which parts of the brain are over-aroused or working a little too hard, or under-aroused, not working well enough. It tells us about the different brainwave patterns going on in the brain. So we get a lot of information from that brain map, and that's how we decide the therapy that we're going to use.
Obviously, it's holistically, the whole body is covered here under one roof. One of the things that folks realize is in our health how important our blood is. But I think many viewers out there have no idea what lymph is or what it does or how it helps us in our immune system. Share with us what you're able to provide here.
So the lymphatic system is really basically been forgotten by Western medicine. Other than surgeons who think about it occasionally, most people don't think about the lymph system. But one of our circulatory systems, in addition to the blood, is the lymphatic system. And really all the fluid that oozes out of your blood vessels and goes into the cells and then out of the cells and into the extracellular space, all that fluid has to somehow get back to your heart and go back into circulation. And that's what the lymphatic system does. So our LET therapy really enhances that process. It allows the lymph to travel along the lymphatic pathways, just like you have blood vessels, you have lymphatic vessels, and it allows the lymph to get reabsorbed into those lymphatic vessels and travel up back to the heart so that you can put all that fluid back into circulation and remove it through the kidneys. The other thing that most people don't know about their lymphatic system is in the lymph nodes is where your white blood cells live. So the lymph system is basically your immune system. And when you enhance the lymphatic system, you enhance the immune system. So we're getting a double whammy here. You're getting that lymph to move, you're getting the immune system enhanced, and then you're getting a detoxification to happen because within that fluid that's sitting in your extracellular space is all the toxins that the cells are trying to get rid of. And you want to move all that toxins out of there and get them out of your system. And so LET helps to enhance that process.
So you're actually moving the lymph. I mean, because obviously the blood is being pumped through the heart, but the lymph, how is that moved along? And that's how you help.
The lymph is moved along by smooth muscles as opposed to muscles like skeletal muscles. So we need to move in order for our lymphatics to move. We need to exercise. We need to breathe deeply. And because we're not doing that anymore, a lot of women are wearing underwire bras, which don't allow the lymph to move in the breast tissue. Most of us are doing sedentary jobs, sitting all day. We're not moving enough. We're not breathing enough. For all these reasons, our lymphatic system is really not moving the way it used to move when people were more active and when people didn't wear quite so much clothing that's restrictive. So all that restrictive clothing, especially underwire bras, are really affecting people's ability to move their lymph. And I really believe it could be a large cause of some of the breast cancer we get. So one of the things I personally brought LET here for is to prevent breast cancer because I believe it could really prevent breast cancer.
It's strange that you said this has gone by the wayside in Western medicine. It sounds like something we need more today more than ever before.
Definitely. And there's a lot of research happening. It's happening in other countries, Australia, New Zealand, on the lymphatic system and on the ability for this to really improve health. It's just not come to this country where people are wanting to talk about the lymphatic system as yet.
Obviously, the life mission that you began when you first started this was really in to get results faster. You realized that you weren't getting the results and you were influenced early on by different means out there. In 2010, you found another treatment that was very interesting to you and you decided to pursue it. Share with me.
Yes, I was just looking up ordering some salt. We use a lot of salt in Ayurveda. And I came across this article about halotherapy, which is salt therapy. And I got really intrigued with it, began to research it, went to Canada, tried out a whole bunch of salt spas there, and brought it to Colorado because it's just the most amazing therapy for respiratory conditions. So I was just very excited about this therapy. It really helps asthma, sinusitis, allergies, COPD, all sorts of respiratory issues. It's totally drug-free. You don't have to take herbs. You don't have to do anything like that. There's really nothing quite like the halotherapy out there.
This is very unique for Colorado because you actually have created a microclimate right here under the roof.
Exactly. So when you come into the salt spa, it is a microclimate. There's a specific humidity, a specific temperature, and we're blowing in a specific size particle of salt. So you're really getting a microclimate that is very soothing to the respiratory tract. It's anti-inflammatory. It gets the mucus liquefied in the respiratory tract, which is a real problem here. It's so dry, the mucus kind of gets stuck in there, and it also kind of activates those little cilia, which is the hairs in your airways, and it gets everything to kind of come on out, and so it works wonderfully for respiratory issues.
Viewers, take a look at the bottom of the screen right there. What you're going to see is her website. That is the East West Integrated Medicine. Since 1999, she's been in private practice serving here in Colorado. You'll also be able to see all the services they provide there as well. They've got a pretty qualified resource link right there where they can walk you through a lot of the research that's been done out there, not only here in the States, but across the world as well. You can also meet their staff and see some of the folks that she has brought on to create a holistic approach in treating your body out there as well. Make sure and sign up for their newsletter. They'll keep you apprised of anything they've got going here, serving the entire Denver area as well as the state of Colorado. One of the things here, obviously, you have gained a lot of knowledge all the way back since 1989 in your studying, be it formally or through people like that of Deepak Chopra. Is your way of giving back really sharing that knowledge with others?
Absolutely. A lot of what I do is really just educating people. So a lot of the visits with me, I always tell people, what I'm going to do is I'm going to teach you how to take care of yourself. So eventually you're not going to need to see me. And most doctors don't want to do that. So, and it's true, most of my patients after a couple of years really don't need to see me because I teach them how to take care of themselves so that they can be empowered. They know what to do with themselves. They only need to see me if something goes wrong and they're kind of a little confused about what to do next. So,
empowering you through holistic health right here in Louisville, as well as a location in Lakewood. Their information is right there on the bottom of the screen. Feel free to connect or contact them at either location. They can walk you through what it takes to set up a consultation for you. That is East West Integrated Medicine. This is Gary Atensi with CNTV. And if you don't know, now you know.